Hello friends, I'm Sheila Myatra, Professor of Anaesthesiology and Critical Care, working at the Tata Memorial Hospital in Mumbai, India. I'm also the chair of the Intensive and Critical Care Medicine Committee of the WFSA. I'm going to be giving you my perspective on reimagining critical care post-pandemia. The importance of critical care medicine has been highlighted during the COVID-19 pandemic. However, this has come at a huge cost to many of us. The best tribute that we can pay to those who have suffered and are no longer among us is to make sure that the lessons of the pandemic are not forgotten and to forge a new path ahead to manage critically ill patients in the future. Anesthesiologists have been working at the forefront during the pandemic. I really like this picture of the Italian anesthetist on the cover of the Time magazine with the accompanying caption, "We must get it into our heads that our lives have changed." The pandemic has highlighted the role of the anesthesiologists as perioperative physicians, and more importantly, the need for us to be even better at managing critically ill patients. Even the best healthcare systems in the world collapsed during the COVID-19 pandemic. COVID-19 has taught us that we need better organization and preparedness for surge capacity. We need to have an interdisciplinary approach. We need to improve our teamwork, especially with other disciplines. COVID-19, being primarily a respiratory disease, was managed like any other ARDS. However, steroids, IL-6 inhibitors like tocilizumab, monoclonal antibodies showed promising results in this condition. Perhaps these agents need to be reevaluated for the management of non-COVID ARDS. Monitoring of our patients, communication with patients and their family was one of the most challenging experiences during the COVID-19 pandemic. In future, we'll have to be better at doing remote monitoring and improve on our communication systems with patients and their families. The mission of critical care has to be beyond just technological advances in the intensive care unit to more overall patient well-being. The post-COVID syndrome has taught us that we not only need to focus on short-term outcomes, but long-term outcomes in our patients post-ICU discharge. A very good example of this is the long-term outcomes following delirium that occurs in the intensive care unit. And one of the most important lessons that we have learned during this pandemic is that we need to focus even more now on compassionate care and family satisfaction in the intensive care unit. And last but not the least, we need to take care of ourselves. Human resources are one of the most valuable assets of any healthcare system. We've lost a lot of our healthcare workers. Healthcare workers have been overworked, overstretched. They watch patients die in isolation. There has been a significant amount of burnout. In future, we have to have better mechanisms to ensure healthcare worker safety in such situations and provide better psychological support to healthcare workers, especially during such pandemics. Thank you very much for your attention.